don't know.
Is that your way of saying we're going to be here long time?
Good evening, everyone, and welcome to the Moscow City Council regular meeting for January 22nd, 2019. Mayor Lambert's out of town tonight, so I'll be officiating, I guess. I would like to have Art lead us in the Pledge of Allegiance.
Please rise and join me in the pledge. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Art.
Welcome.
First thing is I'd like to make an announcement that the public hearing that was scheduled for tonight on the grants will not happen tonight. It'll be rescheduled for a future council meeting. Beyond that, the first thing on the consent is the consent agenda. Would entertain a motion to...
I would move acceptance of the consent agenda as presented.
Second.
Okay, it's been moved by Art and seconded by Catherine to approve the consent agenda as presented. We'll start the roll with Catherine.
Aye.
Aye. Aye.
Aye.
Aye.
Aye. Motion carries.
Well, I'm not sure we have anybody to talk about the staff recognition.
The next thing on the agenda is a staff recognition report. Mr. Reedner seems to be indisposed at the moment, so we'll skip over that, and when he comes back, or is there no? Ms. Hopkins says there is no report, so we'll take her word for that and move along to mayor's appointments, and there are none for this evening that I'm aware of. Number 4 on the agenda is the public comment and mayor's response period. So anyone that has anything to say that's not on tonight's agenda or before planning and zoning or board of adjustment may come to the podium and say whatever's on your mind. We'd love to hear from you. Apparently no one has anything on their mind. They're shoveling snow right now, so we'll move on to item 5, which is the City of Moscow self-funded insurance application and agreements. This is Gary Reedner's thing, but doesn't seem to be here right this minute, so we'll set that one aside and move on to the next thing until he gets back in the room.
Might as well put that one aside too.
Here he comes.
Well, he's making an entrance. Sir, are you willing to do item 5, introduce item 5 on the agenda, the self-funded insurance application? The suspense is killing everyone, but.
Seems like every time I'm addressing the council, I have a cold, so I apologize. Bill, would you get the lights? Okay. Council will recall that we have been working toward a self-funded employee benefits insurance model for quite a long time. It's been a personal goal for me for the past probably 15 years. There have been certain cities in the state, most notably Lewiston, that have had self-funded employee insurance models, and they've worked out pretty well for those organizations. We were considered too small to pursue that, so we looked at some models, just never really moved them forward. Within the last couple of years, the Idaho Department of Insurance has been more amenable to allowing cities of our size, or municipalities of our size, to move forward with a self-funded model. One of the reasons that we wanted to do this is that we believe we can provide great employee benefits, as the city has always provided to its employees, with a more sustainable way of doing that. In other words, when you pay money to an insurance company, as we have for years, we've had a long-standing agreement with Regents Blue Shield of Idaho. They provided great insurance coverage. It's been beneficial. However, as we've talked about, the two factors of insurance are the experience of your employees or the members, participants in the program, as well as inflation and that sort of thing. So when an insurance company sells a policy to or renews a policy with a client such as a city, they look at our performance from the previous year and how our employees have utilized that insurance. The insurance industry likes to have, I believe, around 15% for administration, profit, and that sort of thing. So what they look at is whether the utilization of the policy or the benefits by the employees has been 85% or less. Less than 85% means more profitability for the insurance company. They are not nonprofits, so of course they're looking to get some return on their dollar. And if it rises above that 85% or whatever their target is, then the next year you will see an increase in premium to offset that. And if there's any inflation that goes into that, and as you know, medical inflation has gone up, I believe, 2 or 3 times the national rate of inflation. In other words, the cost of prescriptions, the cost of medical procedures, and that sort of thing also go up. Add on to that, national regulations such as the Affordable Care Act have brought other additional expenses on the insurance industry, which they then pass on to us. So having a self-funded model means that the city, by setting up a separate trust that is separate from the city, and we'll talk about that a little more tonight, there is no profitability in that. It's a nonprofit, so you're not building in profit to the insurance company, taxes that the insurance company has to pay as they are a nonprofit entity or aren't a nonprofit entity. So what we're trying to do is get as close to a sustainable model that allows the city to purchase good insurance, good benefits for its employees, as well as to take out those big swings. Now, naturally, if we have a lot of claims in one year, self-funded or not, the premium or the contribution, if you will, is going to have to reflect that. So there will still be some of that, but it should be less precipitous and variable as you would see in an insurance policy. So the idea is if we can move forward with this, if our application is improved or approved by the Department of Insurance, then we can move forward and become self-funded. So we'll talk a little bit about that timeline as well. And we have Chad and Nellie from the Murray Group, who have been our consultants for many years, have assisted us with this. So they'll talk about that a little bit as well. So the things we need to do tonight, and as I said, we have, and if you'll recall back in May when we first, well, it wasn't the first time we brought it to the council, but it was to the point where we were going to have to pay for actuarial analysis and that sort of thing. We were going to have to stick some dollars into moving forward. We came to the council with the program. Chad and Nellie were here at that time and talked about, okay, what are the steps we need to do this? And you recall there was a fairly in-depth and lengthy PowerPoint presentation talking about the advantages, potential risks, and that sort of thing to moving forward with self-insurance. One of the things that you need to do is we don't provide that as a city. We don't provide the trust, if you will. We appoint trustees, the council would appoint trustees, and then the city would pay its contributions into that trust. That trust then manages the health care coverage with Regents Blue Shield. Regents Blue Shield would still do the administration of the health insurance because we don't want to have anybody in the employ of the city looking at people's personal medical stuff. What we want to do is we've gotten good service from Regents for years. We want to continue that. They will just serve in a different role. So tonight we will be asking you to approve the appointment of 3 trustees to the trust. We've talked to the Department of Insurance, who they recommend should be on the trust. They recommend that your finance director, of course, having intimate knowledge of the city's finances, should be on the trust. So Sarah Banks, our finance director, is a proposed trustee. They've also asked that the human resources director also serve, or someone who's familiar with that. So Jen Piffner assistant city supervisor and acting HR director would serve as a trustee as well if approved by the council. And last, we looked for somebody who was who was more representative of the balance of city employees. So Scott Bontrager, our assistant city engineer, has been drafted into being a trustee as well if approved by the council. The trust then will receive the contributions from the city. They will administer the trust. They will meet as a board. They have a lot of duties as a board. The city will provide services, and one of the other things we will ask the council to do tonight is to approve a service agreement between the trust and between the city and the trust. Very similar to the service agreement that we have with the Urban Renewal Agency. So even though the Urban Renewal Agency is a separate governmental entity from the city, they don't have staff and resources in order to provide administration, bookkeeping, accounting, that sort of thing. So they contract with the city for that. This would be similar to the same thing that we would provide, the city would provide services to the trust so they can discharge their duties as well. So we also have a business, I see I'm ahead of myself here. We have a business association agreement with the Murray Group on behalf of the city. So we would be retaining the Murray Group to advise the city and help us coordinate the city's responsibilities in providing our duties to have a self-insured. And then the appointment trustees, we already talked about that. And then we have the service agreement we just talked about, and they will take you through the additional documentation that we need. In your packets, you will see that the things that the city needs to do, the council, again, recognize the trust, and essentially, as you'll see in your agenda, we're asking the council for direction to go ahead and implement a self-insured program. Recognize the trust, and that's in essence what you were doing, to approve the agreement with the Murray Group, make the appointment of the trustees, and then the service agreement between the city and the trust. So I think now we're into your portion of the presentation. Before I bring these folks up, one of the things that we talked about back in May, the council had some questions on, and I think were exactly what the council should be asking, and that is, when you buy an insurance policy, you're provided coverage under that insurance policy, and you're limited, or your rights are dictated by the insurance policy itself. No matter how big the claim is, of course, there's a top end to it. It isn't endless. But if the city is self-insuring, at what point do a bunch of claims become a burden on the city? So one of the reasons that we hired Milliman to do our actuarial is to look at our past claims and determine what is the level of additional insurance, secondary insurance, if you will, stop-loss insurance that we should purchase. And after going through it, the recommendation is the city has $75,000 of stop-loss insurance. In other words, if a single claim exceeds $75,000, then Regents would cover the balance of that. So the city would be responsible for up to that $75,000. Now, based on the experience that the city has had, there are very few of those claims. I believe last year there were 3, if I recall, that got close or exceeded $75,000. So again, that's our stop-loss base. So if a claim goes above $75,000, then Regents would cover that. Secondly, we have aggregate stop-loss. So in other words, if the city's claims in any one year exceed 125% of the contributions that the city has put in, then Regents will cover all expenses for those claims above 125%. That gives the city 2 safety nets per claim at $75,000 and aggregate at 125% of contributions. I hope I'm saying that correctly. So we've hopefully purchased insurance in order to mitigate or minimize the city's risk. Ann, do you have a question?
Yeah, quick question about that. So if a single claim exceeds that amount, do they cover the entire $75,000 or anything that exceeds that?
Anything
number?
that exceeds it.
Gotcha, thank you.
So we're responsible for the first $75,000.
Okay.
Yes.
And then you gave the number for how many claims last year were 3 for the 75,000. What about for the aggregate?
We never exceeded the aggregate. Yeah, I don't remember, maybe Nellie's got that on the tip of her tongue, but we were below 100% of premium last year, as I recall. Okay, so we never got above 100%, so that was good. One thing I wanted to mention too, the city employees have done a really good job over the last several years being more consumer-based or consumer-driven in their health care. Prescriptions, getting generics when you can, utilizing some other parts of the program, telemedicine, things like that are available under this as we're going forward, so that you don't have to go to the emergency room every time you get a sore throat. Trying to minimize, getting the best care possible, but providing some alternatives for our employees, and that's what this program is designed to do. In addition, one of the requirements of the Department of Insurance, beside the myriad of requirements that you have to meet in order to be approved, you have to have a certain amount of surplus or reserve in order to start a program like this. The reason is you want to make sure that in any 1 month, especially at the beginning of a program, you have sufficient funds to pay claims, because you could have a time where you're paying in your monthly contribution, the city is paying it into the trust, yet for whatever reason, your claims may be front-loaded on your year and you don't have enough premium in the trust to pay for it. So the Department of Insurance dictates how much money you need to have in reserve. As we reported back in May, we were intending to fund that initial reserve or surplus with funds out of the general fund. They will be allocated not only out of the general fund, but the water, all the utility funds will also participate in that. I believe it's somewhere around 67%, if my numbers don't escape me, that the general fund is responsible for, the utilities and other funds are responsible for the rest. So these folks can answer those questions a lot more succinctly than I can, but that's the balance. Recommendation from staff, as I said, we've been working on this a long time. We've been working with the Murray Group for probably the better part of 2 years putting this together. There is a preliminary application with the Department of Insurance at this time. Milliman has revised, gone back, and performed additional work to get the actuarial numbers as exact as possible, and we're ready to pull the trigger on this. If we are successful in our application before the Department of Insurance, we should be able to have a self-funded program effective April 1st of 2019. The only thing I want to say before I turn this over is that it should be an invisible transformation to the city employees. We are not changing at this point any deductibles, any benefits at all. So the same benefits that are provided to employees under the Regents insurance program will be provided to the employees under the self-funded program. So I presented to the employees in a couple of different forums, all employee meetings, to talk to them about it. As you would expect, their main concern is that that they get the same benefits that they had before, and this plan affords that. So with that, I would ask Nellie and Chad to come up and talk about whatever they want to.
Wow. Thanks for having us. Appreciate it. I'm going to walk through kind of where we've been with the application.
Excuse me, could you stand by the microphone so it would be picked up?
It feels weird to stand behind here, sorry. I'm going to walk through where we've been with the Department of Insurance and the application process, just to kind of let you know how this flows and what it looks like on the back end, since you aren't all in the details every day of this. We submitted the full application and binder to include the Milliman actuarial study that Gary mentioned to the Department of Insurance on December 11th. On December 28th, the Department of Insurance came back with a response to that submission and needing some clarification on some items. On January 9th, the City of Moscow responded with the requested items and points of clarification. They came back on the 11th pretty quickly with response to the points of clarification and requests for a conference call. So at that point, myself and our attorney met with the Department of Insurance to discuss further the clarification. They, at that point, suggested we target a 4/1 effective date versus a 3/1, which is what we had originally planned for. They definitely don't like to have too much pressure put on them to review the application. They want to be very conservative in their review and make sure that we have everything that they need. Updated contracts and documents were sent to the city for consideration based on the DOI direction just January 16th. And then last Friday, both myself and the city met just to review finalized documentation. Tonight's meeting is on here. And then with approval from the city council and the newly appointed trustees, they would hold their first meeting tomorrow, if that happens. And then updated documentation would be, and executed contracts would be submitted to the DOI on the 24th. So we're looking to move pretty quickly to meet the DOI's timeline with your approval. So that's kind of where we're at there. Any questions on that?
Clarify why the trustee meeting has to be tomorrow to get the documents signed.
Yes. Oh, and the trustee meeting has to happen tomorrow to get documentation signed, but that would be based on your approval of the trustees, so, yeah. Any questions on the timeline at all? Perfect.
Is there any other questions just in general on the program?
I have a question.
Yeah.
Go ahead, Brenda.
Does do the trustees or the city, or is it still Blue Cross that negotiates with the providers for what will be reimbursed to them for a particular procedure, for example?
Yeah, so part of the administrative fee that you're going to pay Regents is you get their network, and so you get all those those contract reimbursements and things like that. So that's part of them being your administrator, and you lease their network too.
Perfect. So they continue every year to do those negotiations and,
Yep.
okay.
Relative to the initial funding of the trust to get enough money in it to satisfy the Department of Insurance, do those monies eventually get reimbursed to the general fund and the other enterprise funds? Or does that just reside within the trust fund for good?
Can I answer that?
I prefer. Yeah, the trust is a separate legal entity, if you will. It is, once funds are paid into the trust, they stay with the trust. Now, that doesn't mean that, and we will pay employee benefits out of that. There may be other programs for the benefit of employee medical or mental health or whatever that could be funded out of that. But that money does not come back to the general fund or the enterprise funds. It's separate. It's there for this particular purpose.
Follow-up question on that. Do you know what the total dollar amount to fund the initial setup is?
Well, it's fluctuated a little bit. Originally, when it was going to be a 12-month program, I believe it was about 420,000. Do you recall what it is now, Nellie? Yeah, just a little bit in excess of 300,000. And again, that is the amount of money that's in there. It's a function now of the program not beginning until April. So it's a calculation by the Department of Insurance, how much money you need to get actuarially in case additional claims came in that you didn't have sufficient premium saved up.
If we ended up depleting part of that surplus, would we need to keep it at that level and put additional monies in the future?
I'll let Chad.
Yes, the answer is yes. Every year there'll be, the Department of Insurance is going to require actuarial study every year. And so they're going to determine what needs to be in there, so. And those costs for the actuarial fees and things like that are already built into all the monies that are going to be put in there, so it's not additional cost once every year. We've accounted for that because we know the DOI requires that.
Thank you.
One more. So all of the patient billing will continue to be managed through Blue Cross as well?
Yep, through Regents, yep. They'll, to the employee, it will seem the exact same. It's really a function of the funding on the back end, so.
if I may, there's always a certain amount of risk. As I indicated, we tried to minimize that risk as much as we can. If we have, if the surplus is depleted at the beginning, there are things in place to get that, as Chad stated, actuarial studies, and we'll be asked to go ahead and make sure it's adequately funded in the future. It's not that much different from premiums in a private insurance, though. As I said, we start negotiating, or should I say, Murray starts negotiating on our behalf with Regents every year, typically around April or May. They start looking at how have the employees utilized that insurance. And based upon that and other factors, we will receive a bid, if you will. Okay, we'll provide insurance again with these benefits that you've had in the past, but we're going to need to see a 12% increase to that. In the past, we've seen increases as much as over 20%. Typically what happens is we used to budget 15% year in and year out because we weren't sure where it was going to be. The Murray Group has been really good about working with Regents. Typically our increases anymore run anywhere from 0 to 6%, but that's typically year in and year out. So hopefully we'll be able to minimize that a little bit by managing our own trust.
So my question has to do with, because you keep mentioning Regents, and so in the documentation, it talks about that Regents actually deals with all of the issues that come up, and so like on the one about renewal assumptions and conditions, and it talks about that if you have an appeal, you appeal with Regents. So how much different is it then to the employee understanding when it looks like we're holding the trust, but we're still doing all of our medical processing with Regents?
I'll let Chad handle that. Again, we are not going to be processing claims.
Right.
That's not our job. We don't have a network, as Brandy indicated. We're taking advantage of Regents' network. The reason it will be invisible is because we're still contracting with Regents to be the administrator, because we don't want to be the ones processing claims. So as far as appeals and things like that, I'll let Chad expound upon that. But there's some great things about Regents, which is why we could choose to go with somebody else. But we've been getting good service out of them. We're trying to become more efficient in the use of our premiums to Regent and now our contributions to the trust. So we're just trying to be as efficient as possible. But as far as how that goes, I'll let Chad answer that.
Well, hold on, Gary, before you go. When you say the word efficient, which is maybe what you're saying is different than what I'm thinking. What do you mean when you say efficient?
Getting the best benefits for our employees at the most economical means for the city. In other words, sustainability. So that if we're having to pay as part of our premium profit, 15% administration and those sorts of things, if we can provide those services, at least the background being self-insured, we will have to pay for administration with Regents, but it'll be much less than that 15% that we're paying in our purchased premium or purchased insurance policy at this time. I'm probably not stating that very artfully, so Chad can expound upon that. But yeah, efficiency is not about cheapening the insurance or making the employees jump through more hoops. The idea is to try and streamline the process or streamline the method that we utilize for delivering those benefits to our employees.
So I don't know if I specifically understand. Was it something specifically around an appeal process that you would?
Well, no, it just talks about all the things that Regents is actually doing. So I'm just trying to discern the difference.
Okay.
That's what Gary, I think, was trying to explain.
Yeah.
Which I'm sure you had to do with all the employees as well.
Yeah.
In terms of just making it clear that the city itself is not going to, like you said, be processing the claims. And how do you help them discern that if they're supposedly not seeing any difference?
Well, the trust is really a function of the finances and things like that. So that, you want to hire an administrative arm like Regents to do all these functions so that they're not doing those appeals and those types of things. And so there are different ways, like when we met before, there are different ways to self-fund. But this way, when you self-fund with a Regents, Blue Shield of Idaho, or a Blue Cross, they do kind of function as a fully insured carrier, but you're taking out all the taxes and some of their profit, but they still treat you almost like you're fully insured. So to the employee, I think what we want them to understand is there's a fiscal responsibility to have a sustainable plan long-term, but everything else is really going to look and feel the same. So I don't know if I'm answering your question.
You are, I guess, I think just from an economics point of view, why does Regents like it?
They don't.
Okay, then that because I
Sorry.
didn't, okay.
Anybody from
Because I
Regents here?
kept thinking you're saying something that I'm missing, so
No,
thank you.
You're getting it. And Regents, they're all good people, the insurance carriers, but they would rather keep you fully insured.
Okay,
Yep. There's yeah.
I got you.
And, we've got probably 20 to 25 self-funded clients like yourselves in the area that we work with. With the insurance pieces that Gary talked about, the stop loss, the aggregate, and those things, the folks that you have on your trust, and with the administration, I think you guys have a really good handle with the finances and things like that within the organization. If we came into an organization and there was a willy-nilly about the finances and funding the trust, I'd be a lot less comfortable. But having conversations with Gary over the last couple of years, I knew he understood what he was getting into and what he would be getting the city into. And so with the Department of Insurance also kind of overseeing it, there's a lot of oversight that happens, which I think is actually good, even though it's a lot of work to get stuff through there, but it can keep you a little bit out of trouble where there's some employers out there, like private employers, they don't have the DOI to protect them, and they might not have some of those things in place that you're going to have to manage the plan going forward. So just want to throw that in. I feel really comfortable with, the moving forward and the management and the folks that are involved in it. So.
One of the things we did, we had Jen Piffner and I and representatives of the Marie Group had a conversation with the Department of Insurance earlier this spring. And they asked questions, and we were able to answer those questions. Of course, we aren't professionals at it like Murray and the attorney who works for them. But we exhibited an understanding that the Department of Insurance knew that, hey, you've asked the right questions, you've been advised of what the risks are, so on and so forth. And that was a precursor to the presentation that we brought to you in May. And at that time, the council was very comfortable. We weren't at a point where we had the actuarial data yet, so we couldn't ask the council for, okay, this is a go, no-go decision time. We're at that point now. So we want the council, if you're comfortable with it, to, based on our recommendation, to move forward with the self-funded plan.
Gary, I have a question for you. Based on the actuarial data that came in, what would be the most likely premium savings that we would see based on that data? If we had the same experience that we've had over, say, the last 10 years, how much would that benefit the employee contribution to the plan?
Yeah, it's a little bit nebulous, Jim, from the point of course, that fluctuates up and down.
Right. I don't. It's not a hard science thing, and it depends on what experience is in that case. But what's the midline of that? Not the best case if nobody gets sick, and not the worst case if everybody gets cancer.
If it follows the trend, we should see inflationary increases only. We're planning on as long as we can, based on the experience, of course, is the big deal. If we can keep managing it correctly, the employees managing their health care, efficiently, we believe that we can keep premiums level into the future until inflation catches up with us. Now, there are things
we've been experiencing, 15, 20% increases in premiums year over year, and if we can stall that, it seems like it's well worth it.
Yeah, and we haven't seen a 20% in the last 10 years. We've seen some 12s, but again, actively managing it and with Murray acting on our behalf. And we have a long-term relationship with Regents. I think we've been with them 22 years or something like that. So there have been times when maybe even their actuarial data is such that, well, you know, we should see a higher premium. You guys have been with us a long time. And of course, you recall when Walter Steed was on the council, his advice was to go out every year and look for alternatives, put it out for an RFP process, if you will. And we did that on several occasions to check and make sure that we were getting as good a deal from Regents as we could. And we wanted to make sure that somebody wasn't, quote, buying the business, unquote. So they would offer us premiums at a discount and then in subsequent years of the contract, jack it back up. So we've been managing it, as I said. We've seen years of zero premium, 2%, 3%, 6%, but we haven't seen the big ones lately. And again, I credit the employees with the management of their own health care for a lot of that. And programs that we've got through the Murray Group, through some other healthcare providers to try and help the employees make those more informed choices for their health care.
Thank you. Any further, Randy?
With the different options, looking at the stop loss options of 75 versus 100,000, is that an obvious choice for us to choose the 75? And how is that?
Yeah, again, it's
recommended?
management of risk. And as you can see, the premium or premium per employee is less for the $100,000 stop loss, but the city then is accepting on every claim that additional $25,000. $75,000 seemed to be based on the actuarial data and the experience, looking at the number of claims that exceeded $75,000 in previous years, that was a good acceptance of risk, and the premium was fairly reasonable. And as you can see, there's 4 different choices on that sheet, and you can look, I'm not going to try and explain the 1013 and the 1010. These guys can certainly, or is it 1213, whatever it is. Anyway, what we're trying to do is minimize as much risk to the city for a reasonable premium. So that's why $75,000 was chosen. You know, for instance, if you have a situation where, God forbid, you have 5 employees or their dependents who have health issues, and you had 75,000 versus 100,000, that could be the difference of $125,000 in expense to the trust.
So when you hear those occasional stories of a city that's gone self-insured and it's been disastrous, are they usually not getting this insurance, or are they being too optimistic with what stop loss they're signing on for?
Some of those situations is why the Department of Insurance has gotten more strict around their processes and what you have to do. There was some situations, I don't know, maybe it was 10 years ago, where some cities got in some trouble because they got together and they didn't have the proper stuff. They didn't have the right networks in place, so they weren't getting the reimbursements. And so the DOI is kind of doesn't allow some of that now. And so I don't think, I don't see some of the same things in today's environment. And one thing I'll add to what Gary said is, the whole idea of this is to build up the trust. So that in a bad year, the trust is not coming to the city and saying, we need 10%. Give us 4%, we're going to offset it with 6% that we already have in the trust. And so hopefully we get to a point where we're building up, I'm going to call it a nest egg in there, that, because there's going to be some bad years. I've got a slide that shows 10 years of history, and there's going to be some of those. We say 1 out of 5 or 2 out of 10 years, there's going to be bumps. And so, but in those 8 years out of the 10, we're building up money in that trust, we're going to be able to weather those couple bad years. So that's the idea of that.
And again, insurance companies do the same thing that we're doing here. They're assessing their risk. However, in a year, say, that we beat as employees, we beat that 85%. Say we only utilize 75% of experience, so the insurance company essentially has 10% more than they had expected or budgeted for that they retain. We don't get any rebate for that. we may see a level premium the next year. The beauty of the trust is that money stays in the trust. As Chad said, it's built up, it doesn't go anywhere. And you can use it to mitigate higher contribution costs. You can utilize it to do some other things, provide other health benefits to the employees, so on and so forth. So it just gives us more control. And again, it's a management of risk. I feel bad I didn't bring this up in the first part of my presentation, but yeah, 2 out of 10 years, certainly you're going to see something above what you'd expected. But that other 8 years where you can actually keep that money in the trust, provide some of that stability, seems like a good risk. And that's what we brought Milliman in for. That's why the Department of Insurance is carefully watching the application process. And we looked at it from a staff level. Murray's looked at it. And this is the package that we feel is comfortable and a reasonable assessment of risk for the city.
Further, you had a further presentation at all?
No, a lot of what's in here is what we've looked at before. The one slide we didn't look at is we have a 10-year snapshot. I don't know if that, but all that shows is, if you have your expected claims, your contribution that Gary was talking about at that 100, shows how your months go. And so the cash flow, you can see where some months, maybe you only, if you pay $100,000 in premium to the carrier, maybe they only paid $30,000 in claims. So there's a $70,000 delta that they're just keeping. So I just to show you how that's going to fluctuate. But other than that, it's a lot of the same information that we went through a couple months ago.
Okay, thank you.
One other, this is probably for Gary maybe, but is there a term for the trustees or?
3 years, was it? Yeah. Term of appointment. I'd have to look at the bylaws, but yeah, there is a term. I believe it's 3 years, but we can check back. Do you know?
Scott probably knows what he's
And then if
getting in
there's ever a
for.
change of trustees, does that,
Sarah, you know what you're in for there?
okay. Way to say yes. I guess as a follow-up to that too, if at some point, say after the term and someone wants off and someone else is going on, does it come back to the council or is that just determined by the remaining trustees?
No, the
Okay.
council appoints.
Okay,
Yeah, I'm sorry, I don't have that.
that's okay. Just knowing there is a term
Okay, if
defined somewhere.
there's no further discussion or presentation, we have 4 action items here to deal with. The first one is to improve the implementation of the self-funded employee health benefits program. I would need,
I
we'd
do
need a
want to
motion.
see the 10-year history slide. That was the one I requested, please.
Does it look a little familiar? Last time. Sorry, it's at the end here. So that was I think a 4-year, and this is just under a 10-year. And what you can see, that red line is really the line that, let's say that the city's paying $100,000 a month in premiums, that's going to the carrier. This is how they're paying the claims, and so you can see how many months are below that 100,000, so to speak. And you can kind of see a trend line on that the other colored line's a trend line down. And so in all those months, so let's say you're budgeting $100,000 a year that goes into the trust. In a lot of those months, you're paying a lot less in claims. And so the city's going to actually get a weekly invoice from Regents on claims. So that cash flow is going to be a little bit different for finance. And you see, and there can be a month, I can't read that from here, but you can see that real couple high peaks. And those typically, I think we determined they were around maybe the same time of year. I can't remember when exactly those were, but there will be some months where it's above the 100,000 potentially. So, but what I will say is, in every self-funded plan that gets off the ground and starts, claims, there's about a month and a half lag in claims. So from when you go to the doctor and when they bill and all those things, it takes about a month and a half. And so right away, we're going to start off with about a month and a half lag. So the first year always looks good because you're missing about a month and a half. But that also there'll be some money in the trust there too. So, but this is that 10-year.
Thank you. With that, I would move that we approve the implementation of a self-funded employee health benefits program, including the submission of an application to the Idaho Department of Insurance.
Seconded.
Okay, moved by, and seconded by Art to approve the implementation of the self-funded employee health benefits program. Any further discussion on that? Start the roll with Ann then.
Aye.
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 Okay, motion carries. Okay, now the second thing that we have to have a motion on is to approve the appointment of Jennifer Piffner, Sarah Banks, and Brian Scott Bontrager as trustees.
I would so move.
Second.
Moved by Art, seconded by Gina. Start with Catherine.
Aye.
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 Aye. Oh, sorry.
Carries. Okay, item number 3 on our list here is approve the proposed service agreement for trust, health plan, and benefit administration services provided by the City of Moscow to the City of Moscow Employees Benefit Trust.
So moved.
Seconded.
Okay, moved by Gina, seconded by Art. Start with Ann.
Aye.
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 Okay.
Horace.
Okay.
I move to approve the business associate agreement between the City of Moscow and the Murray Group.
Second.
Thank you.
You're welcome.
Catherine, second by Brandy. To approve the business associate agreement between the City of Moscow and the Murray Group. Start with Catherine, since you made the motion.
Aye.
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 Okay, that all carries.
Your Honor, could we take like a 5-minute recess so I can have you execute the documents?
Certainly. 5-minute recess. I have no gavel. I'll bang the pen. Okay, welcome back, everybody, after the short recess to sign the documents. We're back with item number 6 on tonight's agenda, which is the proposed adjustment for post-academy attendance. Gary's going to present on that.
Thank you, Your Honor. What you have before you is a request for the council to approve police officer and standards and training academy expenses for overtime. For the past, certainly predating my service with the city, police officers have been required to attend police officer standards and training in Boise, now Meridian. And when they go to that academy, they are required to meet the academy objectives, the schedule, and sometimes, in fact, most of the time, it requires cadets to actually put in more than 40 hours per week. The Fair Labor Standards Act, if you are an hourly employee, mandates that you receive time and a half overtime for hours put in over 40 hours per week. There is a safe haven, if you will, for certain activities if it is a bona fide apprenticeship program. And I believe that, again, predating my working with the city, and I came here in 1992, apparently there must have been some designation that it was an apprenticeship program. However, the FLSA has specifics that you must comply with if it is an apprenticeship program. One of those is that you have to have an agreement with the employee that they are participating in an apprenticeship program. And there's a question whether or not city and state mandated requirements for certification as a condition of employment meets an apprenticeship program. So, this was brought to our attention last August. So it's been going on for years and years, and it was brought to our attention in August. So brought the city attorney in, asked her to review it to make sure that what we were doing was correct or whether we needed to rectify that. The conclusion from the city attorney and administration was that we weren't doing it correctly. That even though it may have been bona fide, that we thought it was an apprenticeship program, in fact, it likely was not. So we looked at what we had to do to rectify that situation. So we had information that it was going to be about 70 hours of overtime. So we went back and looked at the city's records as to what officers who had attended post while in the employ of the city for the past 3 years, because that's a statute of limitations for bringing in action on back wages. So we looked, there were 9 officers that fell into that category. Since that time, and we were going by what had been represented to us as about 70 hours of overtime. It turns out that that is in fact incorrect. It depends on what classes individual officers took. It's my understanding, and we just did additional research last Thursday and Friday, that if you're authorized, meaning if you're a law enforcement administrator, you can actually go back and check Post's actual records that list out the classes that each individual officer took. That isn't available to HR or administration. So the numbers that I gave you back at last week's administrative committee meeting have been modified somewhat. So we took the actual overtime that Post had logged for these individual officers, and we will adjust their pay accordingly. And that's fine. We handle that administratively because it's a liability of the city and it's within administration's authority to do that. However, we do have officers who were in the employ of the city when they were mandated to get Post certifications that are still with the city who attended prior to 3 years ago. So I brought it to the administrative committee that requesting the council, it was my recommendation that if we've been doing it wrong, even though it was good faith, that the council, my recommendation that the council consider going back, taking all of these officers who are still in the employ of the city prior to that 3 years and calculating up what their overtime, what they would have been entitled to in overtime, and make it right with all of the officers who are still with the city. Now, we have significant numbers of officers who attended on their own, or they moved in as a lateral. In other words, we have some officers who started off with Latah County, started off with City of Lewiston, came from other states. So they, of course, wouldn't fall into that same category. So we have several officers who are in that category as well. I represented last time that the liability was estimated to be around $52,000. It's looking like it's going to be more in the $70,000 range. That will take care of both the officers who have been adjusted already or need to be adjusted further, and those officers who have been with the city longer and attended post prior to 3 years ago. So we have capacity within the budget appropriation, as I indicated at Administrative Committee. If that proves to be insufficient, we will bring it back to council when we have the open budget process. Administrative Committee reviewed this, agreed that the city wanted to do the right thing by these officers most of them have been longtime employees of the city. So I come before you tonight with some modified numbers, but representing that we do have the capacity, I believe, within the budget to do that, and asking for the council to approve us to adjust the overtime pay for those employees who aren't within that 3-year period that they attended post.
So, the adjusted numbers are based on post having more accurate record documentation of the amount of time. And so in the, those adjustments aren't on here. You said the total was more like 72, is that what you just said?
Somewhere around that. 70 to 75, as I'd say, would be a pretty conservative estimate. Interestingly enough, we have 2 officers who attended post while they were in our employ who are no longer employed by the city within the past 3 years. Of course, our responsibility to take care of those, even though they are not employed by the city, is the same as those officers that remain in our employ. But
So, yeah.
I don't have exact numbers for you, and the reason is the information from post, I first saw it on Friday, requested there to be more, not just the compilation of information, but the actual documentation from post. That was delivered to me today about 3 o'clock.
Okay.
So we're still going through that.
And then for the ones looking back, the pay, was that based on what their pay grade was at that time?
Exactly.
Okay.
Yeah, it wouldn't be fair to take the chief
Yeah.
of police, for instance, and pay him time and a half at his hourly now when he's not even an hourly employee anymore.
Ann?
Yeah, just as a point of clarification, was it more than 40 hours because the training was more than 40 hours that week, or was it in addition to time spent on duty?
It's interesting. They've changed it. Our officer with the most experience, Captain Will Krassel, when he attended, it was a 7-week academy. So essentially what they tried to do is stuff so much into 7 weeks. Unbeknownst to us as administrators, HR, and at the city, was that other agencies were paying their employees if the classes took place outside of the 40-hour work week. Then they switched it to a 10-week academy, which worked for a while because the agencies that were paying overtime were complaining, I would say, that you're giving us so many extra classes, it's eating us up in overtime. Why don't you just make the academy longer? So they did, which held for a while, and then they did the same thing. They started adding more requirements, more outside the 40 hours within the 10-week period. So to rectify this whole situation, Post is now implementing a 15-week program that will provide training within 40 hours within those 15 weeks. Now, that's not optimal to us either. That takes our officers out of the city for 15 weeks. But we have a reasonable assurance that what they're being required to do can take place within that 40-hour work week. Did I get close to answering your question?
Thank you.
Thank you.
Gina?
I do think this is exactly the right thing to do. Whether it's a 7-week or a 10-week or a 15-week, if they're working more than the 40 hours, we have that responsibility. So having said that, if it's all right, I'm going to go ahead and move that we adjust affected police officers pay pursuant to the attached memo to compensate them for the overtime incurred while attending post-academy.
Second?
Okay, moved by Gina and second by Catherine to go ahead and adjust the affected police officers' pay pursuant to the attached memo to compensate them for overtime incurred while attending the post-academy. Any further discussion on that? Ann?
Aye.
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 Thank you. On behalf of the police officers, I thank the council for their support, and certainly as administration and HR. Again, we apologize that this was not rectified earlier, but thank you.
Thank you.
Gary. Okay, item number 7 is alcohol resolution for city-sponsored events in City Hall. And looks like Amanda Argona is going to take over for Jen on this.
It wasn't apparent Jen couldn't be here this evening. I think she's in Boise already. Good evening, council members and staff. What you have in your packets is a resolution from the Community Events Division. We are proposing that beer and wine be allowed in the form of a no-host bar to be served at certain pre-approved City of Moscow-sponsored community events held here in City Hall. By passing the resolution, requests to have a no-host bar at these events can be approved administratively to expedite the process, in addition to providing flexibility for those events that want an enhanced atmosphere. If approved, the first event to utilize this resolution would be Love Your Farmer, Love Your Food, which has been scheduled for Wednesday evening on February 20th from 6 to 8 p.m. right here in this room, so please mark your calendars accordingly. Other events identified that may utilize this resolution if passed would be executive socials as part of the Town and Gown Initiative, City Commission Fair, and other such events. So staff is asking the council to approve this resolution, and with that, I'd be happy to try and answer any questions you may have. I think there's one right off the bat, down at the end.
Yeah, I thought that was good discussion at the Farmers Market Commission meeting about the times that the events, could you go into that a little more?
Yes, at the administrative committee.
Yeah.
Pursuant before this resolution, there is a resolution on the books right now for 3rd Street Gallery openings currently offered by the Arts Department. And really, staff is required to be at these events, so we try really hard to not work too many late nights, and so it would be restricted to I believe in the resolution it'd be between the 5 p.m. and 8 p.m. hour for the consumption of the alcohol, the selling of the alcohol as well. And so our event, Love Your Farmer, Love Your Food, ends at 8 p.m. Other than that, there aren't currently any other events that would be offered at this point in time, but like I said, it would allow that flexibility if other folks wanted to. City of Moscow, city departments, commissions specifically wanted to offer events.
Gina.
So I'm remembering some conversation too around notification of the council during those things. And not that I only want to come to alcohol-related events, but I like to know when we're doing things and sponsoring these kind of things. So what have you come up with for us?
Currently, the event is out on Facebook. I think we talked about this. We can put something like that in the resolution if council is interested in having that, but we have started the marketing process for this event in particular. It was actually on my radar to send to DJ Skaloran, the administrative specialist, to get on the City of Moscow website calendar, but we have started to actually put it out there already that this event will be hosted, and so email can go out to all city users, and we're still about just under a month out from the event happening.
If I may.
Yes.
I'm also informed you can sign up for alerts for those specific things if you like.
For alcohol-related events?
I'm on that list, so yeah, I know it works.
I needed to be on it for a long time.
Yeah,
Is that a yes?
apparently you can limit the alerts that you want. So we can help you with that.
There you go.
Okay,
City clerk will help
you
you.
guys set me up. Okay. So maybe that's a moot point, but I did not realize we could filter for that sort of thing. So I just think it's important that we know,
Absolutely.
so.
The thing I see that separates this from events in the park and downtown is that this can be administratively done without having to go to committee and to council
Correct.
for approval, that it can be done administratively, and so it's less cumbersome in terms of having events in this room.
If I can comment on that as well, the idea is to provide some flexibility, as Amanda has indicated. You've already provided that flexibility for art openings. So we're just expanding that a little bit because we separated the arts department from community events. And as Amanda has indicated, there are some things community events would like to do that were okay before because they were under the auspices of the arts department. So this cleans that up. Jim's exactly right that to allow it to be determined administratively, because the only people who can get this are city people. It has to be a staff member, staff liaison responsible for a city commission, the elected officials. It has to be a city function. Whether you talk about rendezvous, events in the park, Friendship Square, closing down Main Street, those are typically, although some of them are city events, they involve other people. In this case, it is only the city. So like Rendezvous handles during their events, so that's why the council passes a separate resolution, so the police chief talks to Rendezvous, makes sure that their security is okay, so on and so forth. So that's why we're looking at a single resolution that provides that flexibility.
Yeah, I just wanted to be clear that that's the difference
Yes.
between those other things. Okay,
Well, I'd like to move approval of the proposed resolution.
Second?
moved by Art and seconded by Ann to approve the proposed resolution. Start with Catherine down there.
Aye.
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 Aye,
Aye.
motion carries.
Do you have to read the thing now?
Thank you.
I don't, the resolution complete to the point where I need to read that, or it's not an ordinance, so I
You
shouldn't
don't
have
need to read it, you just need
Yeah.
to pass it.
Right. Okay, moving on to item number 8, Stormwater Phase 2 Agreement with Aspect Consulting. Kyle Steele's going to fill us in on what's going on with that, and
Your Honor, may I be excused, and Bill will be acting city supervisor.
certainly. Thank you. You have to travel in the snow, so be on your way and be safe.
Thank you.
Still snowing.
I can't tell.
Good.
Okay, proceed, Kyle.
Good evening, council members. We're excited to be here tonight to continue our discussion regarding stormwater management in the city of Moscow. Just a little bit of background, as you're aware, the city of Moscow and EPA have been, over the last decade or so, talking about stormwater management and permitting requirements under the federal stormwater regulations. Stormwater management in terms of preventative maintenance, infrastructure repair and replacement, a dedicated staff to implement various programmatic activities in Moscow has been largely non-existent. And this isn't just unique to Moscow. This is an issue that's facing the nation and, you know, in water, sewer, and stormwater infrastructure. The impending permit that just went out to public comment will require the city to implement a comprehensive stormwater management program and will require the city to have the resources necessary to comply with the permit. The goal is to be proactive rather than reactive, and that's really where we've been at over the last 80 years, is operating that kind of utility. Currently, we do not have a funding mechanism in place like we do with our other utilities to meet the regulatory demands of the permit. Knowing this, back in 2016, the city contracted with Cardinal GS, which is now Aspect Consulting out of Yakima, Washington, to help us formulate and eventually implement a stormwater utility. Due to budget limitations at that time, the study was broken up into 2 phases. Phase 1 of that has been largely completed. So tonight before you is a task order with Aspect to complete the remaining work. Tasks to be worked on under this task order include the preparation of a stormwater billing database, a final stormwater management program budget and financial plan, the development of a stormwater user fee ordinance, as well as assistance at various meetings and workshops. The cost of the task order does exceed the amount that we had budgeted in the current fiscal year. But because of the impending approval of the stormwater permit, staff is recommending that the council approve the task order in order to move this project forward. The additional funding will be reallocated in accordance with the memo that's in your packet that came from Tyler. So this was reviewed by Public Works and Finance at their last meeting, and they recommended it for approval. So with that, I would try to answer any questions you might have.
I have a question just about the timeline on the tasks, on the schedule. So it looks like it's going to take a couple more years to get everything in place, to get implementation done?
It's we're expecting it to be about between 9 and 12 months.
So from starting, we're considering 2016 part of the timeline now, even with the name change. We started in 2016, so.
Correct, yeah.
Full
Phase
time.
one of it.
Yeah, okay.
Yeah. So we've got about 12 more months worth of work.
To go, okay.
Anyone else?
I was just going to comment that with the impending permitting from the EPA, we need to stay ahead of this whole operation. Otherwise, we're going to get into hot water and find ourselves trying to play catch-up, and that's going to be even more expensive. So I think that we need to go ahead and approve this task order.
Entertain a motion.
Oh, well, let's approve the task order 2 for professional services of Aspect Consulting in the amount not to exceed $185,000.
Second.
I'll give it to Ann there. Okay. Moved by Art and seconded by Ann to approve task order number 2 for professional services of Aspect Consulting in the amount not to exceed $185,000. Start with you, Ann.
Aye.
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 Thank you very much.
Thank you, Kyle. Item number 9 is a proposed lot division at 334 Southview Avenue. Leah was going to do that, but someone less attractive is going to do it now.
The acting city supervisor himself.
Oh, shush.
Wow.
That's entirely from my perspective.
Well, good evening. Happy to be
No one's
here.
going to second that one.
Happy to be here. Jeez, I tried to do something nice for her. She didn't have to sit here. It was a long agenda. I thought I'd cover it. Okay. So what is before you is actually a lot division that was reviewed by the administrative committee and recommended for approval on consent agenda, but with a mix-up, it didn't end up on the consent agenda. So it's on our regular agenda this evening. I'll run through it fairly quickly. So what is proposed is a request from the Moscow Fair and Affordable Housing, or Moscow Affordable Housing Trust, to divide a parcel of land they recently purchased on Southview Avenue, kind of shown in yellow on the site plan here, from a single lot into 3 townhome lots. So the property does front on Southview. To the north, our residential property is up on Indian Hills Drive, and to the south is multifamily development of the Grove Complex, just there to the south. So a little bit closer view of that property. Again, Nurse Ferry located here, running north-south, and Southview here to the south of the subject property. The lot is 9,247 square feet in size, and the proposal is to divide it into 3 townhouse lots, ranging in size from just a little bit under 2,600 square feet to just a little bit under 3,400 square feet in size for those 3 lots. The property is located in the R3 zoning district, which is our moderate density residential zoning district. To the north, we have the R1 district, and then the yellow shaded areas here are R4 to the south, and then R2 here to the east of the property. Within the R3 zoning district, it does allow for single-family, 2-family, twin home, and townhouse dwelling units. For townhouse lots, they are required to be at minimum 2,000 square feet in size and 20 feet in width. All the proposed lots would meet those standards. Widths vary from about 35 feet to about just under 28 feet in width. And as I mentioned, that just under 2,600 square feet in size to just under 3,400 square feet in size. So this is a conceptual site plan of the proposed division of the property. Per city policy, we did notice this before the administrative committee. All residents within 600 feet of the property were notified of the proposal, and no public comments were received at the administrative committee. The committee did review the proposal and recommended approval of the proposed lot division with no conditions. And I'd be happy to try to answer any questions you might have.
I have no questions, but since it did make it onto the regular agenda, I would just take the opportunity, which I wish I had done at that last meeting, to thank Nils Peterson and the Moscow Affordable Housing Trust for continuing to look for solutions and provide options to address the affordable housing crunch here in Moscow, so.
Excellent.
Jim? What I remember from the administrative committee was that there were no reasons not to approve this. This is a good project. It was all within the lines and the boundaries of what we expected from all of our zoning and everything like that. So to be honest, I'm anxious to see what you come up with, Nils. And so I move that we approve the lot division request with no conditions.
Second?
Okay, moved by Gina, second by Ann, to approve this lot division. Start with Catherine.
Aye.
Aye. Aye.
Aye.
Aye.
Aye.
Motion carries. Build it, Nils. Okay, item number 10, amendment to Comprehensive Sanitation System Master Plan Services Agreement. Tim Davis is going to fill us in on that.
Good evening. Before you this evening, we have an amendment to the Comprehensive Sanitation System Master Planning Services Agreement with Great West Engineering for your consideration. The proposed amendment is the next step in making improvements to the Moscow Recycling Center and Yard Waste Facility and involves preparation of preliminary design work at the existing site. City Council Sanitation Master Plan Workshop presentation by Great West Engineering concluded their scope of work and tasks, as no additional design work was contemplated in that original agreement. Based on the results of the Sanitation Master Plan and discussions at the City Council workshop, staff understood the direction to be to explore integrating prototypical conceptual facility designs that were developed by Great West Engineering to the existing Moscow recycling site. This will require relocation of the baling and processing building from the existing site. Relocating the baling and processing portion of the recycling center to the solid waste processing facility operated by Lata Sanitation will also free up additional space at the recycling center site and allow the city to move forward with the needed improvements. The proposed preliminary design amendment submitted by Great West Engineering will require development of up to 2 schematic layout designs for the Moscow Recycling Yard Waste site for future City Council consideration of a preferred alternative. Once that preferred alternative is selected, Great West Engineering will provide preliminary design drawings and technical memorandum and preliminary level cost estimates. The proposed cost of this amendment is $35,700 and is anticipated to be complete in approximately 4 months' time. This was reviewed by the Administrative Committee. I don't know that any decisions were made by the Administrative Committee, but it was forwarded to full council. So with that, I'd be happy to try to answer any questions.
I just remember that we asked for you to bring it forward because this has been such a change for everybody. So we were just wanting to make sure that if there was any other questions, that were.
One other thing that was discussed at the admin committee is there's a couple of things that will have to fall together before we move forward with any improvements at the recycling center. This is just one of those things, and this is going to be a very preliminary design to see. If you remember, Great West put together a couple prototypical conceptual designs, and one of them used a 3-acre site. The other used a 2.5 acre site. The existing recycling center is about 1.7 acres. And I don't remember which council member asked, but there was a question asked of Great West whether some of these prototypical designs could be implemented at the existing site, and they said indeed that they could. The other thing that will have to happen kind of in concert with this is, depending on what that preferred alternative looks like to council, we would have to go forward and ask Latah Sanitation for a proposal to move that baling and processing building out to their site. And then, along the way, we're putting together cost figures too. So we know before we go in and say, okay, we're going to start doing improvements at this site, we're going to know well ahead what those costs are.
I think that along the lines of the question I asked or both of these designs were with the existing baling building gone, and you said yes, so are we confident that that will be what needs to happen? So we don't want to have a option that presumes it's staying there. Is there any chance that it would have to stay there?
I don't think there's any way that we
Okay.
could, put in those prototypical designs on the site with that building sitting right in the middle
Okay.
of the site there.
I think part of our conversation as well was the communication of what moves and what doesn't. I think it was very clear during our first, the workshops, that people don't want the recycling center to move. I think the communication of exactly what moves where is very important. I think we had talked about that briefly, and then, it was part of the discussion. So I think that we need to do this discovery and figure out what these potential designs and such are. But there needs to be a very clear communication plan at the same time. Not that you don't have enough balls in the air, but that was quite a clear message from the community the first couple times. So,
To be clear, was there a recommendation from the committee? No, just to forward it on to us.
I think it was just a decision, that it should be on the regular agenda since everyone has been involved with the workshop and.
Yeah, I attended the workshop, and it's a very complex issue that's changing rapidly because of the pricing of recyclable commodities and how we're going to deal with that. And I think we all agreed that it has to be something that's flexible because things will change in the future, and they could change very rapidly, and we need to be able to deal with that. And certainly it's worth the additional research money to not paint ourselves in a corner. And so personally, I'd be in favor of this.
Why don't you make a motion?
Well, because
You're allowed.
you're going to allow that? I
Yeah.
didn't want anybody to say, well, you're usurping. But, okay, I'll move that we accept approve the proposed amendment to the Comprehensive Sanitation Master Plan with Great Western Engineering.
second.
Okay, moved by me, seconded by Gina. To do so, start the roll with Ann. If there's no further discussion.
Aye.
Aye.
All right,
Aye.
Aye.
good.
Aye.
Motion carries. Thank you, Tim.
Thank you.
Okay, now we're down to reports. Guess we'll start with Ann on that.
Yeah, I had a kind of bumpy month in terms of attendance. I was not able to attend Pathways or PBAC this month, but I was able to attend Transportation Commission meeting. And the big topic there was just a review of basically all of the projects that had been happening in FY18, and then what we were looking for, or what was going to happen this year. So that was the big thing. And then there were a couple questions, which I think will be addressed at a future meeting, but one of the things that was brought up was the four-way stops at Hayes and at Blaine. And there was just some requests for clarification on whether or not those would be happening. So I thought that was worth mentioning as well. And then Human Rights Commission met last week, and they are talking about and starting to plan a social justice forum that I think will happen in February. They're looking at sort of locking down who will be involved, and their topic will be refugees and immigration. And so I'll have more information for you all as that develops. And then just a shout out to them for planning the breakfast this weekend, and a special shout out to Ken Fonts, the chair and also an award winner at that breakfast. And then not pertaining directly to this, but I was able to attend the Women's March as well, which was a really great opportunity. I was able to talk to a lot of women that were there about running for office and what that looks like, and so hopefully it'd be great to see some exciting candidates in the next couple of years, and that's it for me.
Art?
A couple of things. One was Moscow Urban Renewal Agency met, and Brandy and Bill cover anything that I miss. But we extended the exclusive negotiation agreement with the Needhams about extending the Alturas Analytic Labs out at the Alturas Park, and that's proceeding along, but because of the complicated nature of designing a laboratory building, they needed a little more time to finish their work there. We have submitted in response to an RFP for the 6th and Jackson lot, 3 potential plans for buildings and development on that long abandoned and long cleaned up lot. So there's some progress going on there, and things are actually moving very nicely with the URA these days, I think. On the Palouse Knowledge Corridor front, there's a new format. Instead of the annual Be the Entrepreneur Boot Camp that takes place across the course of 5 days consecutively, it's being divided into 2 parts. First part in June, second part in September, to give business people and incipient business people more time to think about what they're doing and less time off all in a row, and that should help them a little bit. And also reaching out to high schools about an innovation, inventor-driven products that would occur earlier here in the spring. So those are all under development by the Palouse Knowledge Corridor. And that's what I had.
Okay. I'll just, if we're just going down the line here, I'll kind of piggyback on Ann's thing about the PBAC, since she wasn't able to attend. There was a communications subcommittee meeting, and the University of Idaho has a grant to study what the public perception is on the various alternatives and what the attributes of those are and how the public perceives those, so that any advancement of one of those options can be done in a reasonable fashion without annoying more people than need to be annoyed. So that'll be underway over the next year. I went to Smart Transit today for the first time, since Ann's not on there anymore. And the crux of that is that they'll have to do a little more in-depth audit this year because of overspending the federal guidelines of $750,000. So they'll have a little more in-depth audit that costs $3,500 extra, and we'll probably have to do that for the next 2 years until we get caught up on the bus replacement. And then it will drop back to what it has been in the past. Yeah. Randy?
I'll just add one little thing to when Art mentioned the RFP, the proposals coming for the 6th and Jackson lot for the Urban Renewal Agency. And on February 7th, those presentations will come to the URA to be followed by public comment. And that meeting is at 7 in the morning on February 7th. Planning and Zoning met on the 9th, and there's discussion about the limits on recreational vehicles. Currently, they are only permitted to stay in place for 6 months. There's been a request to eliminate that limit that came from a citizen, so Planning and Zoning is looking at that. Possibly one option would be just eliminating that limit in mobile home parks, but not in RV parks. So they're continuing to discuss that. We'll come forward with some recommendation on that. There's updates to the floodplain ordinance that will be coming to a public hearing. It's in draft for planning and zoning review. And there was also a subdivision code review, which was really interesting. There were the Chair Wendy McClure did a presentation, and Mike Ray as well, of what clustered developments and residential areas can look like. So that was very interesting. That's all I have.
Okay, Gina?
If I can add one thing to your smart transit update, Jim, the overspending that occurred was not due to poor budgeting. It was due to unforeseen expenses such as engines blowing and that sort of thing. So that's what triggered that. It actually, in a $780,000 year, it was $38,000 worth of expenditures. So it was a very small amount. And with procurement of very expensive buses and that sort of thing, it gets you really close to that border anyway, and then any of those unforeseen circumstances cause that overage. So it wasn't loose-handed money. It was, unforeseen. Okay, I attended the volunteer fire department meeting, and they're right in the middle, in fact, smack in the middle of their strategic planning, and are starting to ask themselves some really cool questions about some of their bylaws and whether or not they're still applicable to what's going on nowadays and that sort of thing. So it's pretty exciting. They are talking about Station 1 remodel, and they opted the same meeting to move forward with a couple of the pieces of, there are 5 pieces to their remodel, and they actually are going to move ahead with 2 based on their budget, and then they'll get cost estimates for the other 3. So really good consensus building moment on the part of the chief. I was impressed with that. They set a date for the crab feed. For those of you that are into that event, get your schedules out and mark February 9th as your crab feed date, and they will also very soon set their steak feed date. So a lot of good food coming out of the fire department these days. I also attended, and I don't have the date written down, but it was last week one day, the second of 2 Edible Forest Park workshops. Great, 25 to 30 people, great attendance. They went over the initial survey that was done at the first workshop. They went through some of the data, and then they talked about the designs that had come from this first workshop. And it was interesting to look at both of the designs and how one was so dramatically different given the same set of data. It was kind of interesting. There were lots and lots and lots of questions regarding water, regarding, what do we do with, is there a wild spot in the design, or is it all going to be cultivated? And it is, if you guys are aware, it's that lot down near the Grove, so it's fairly precipitous. And for those of us who maybe aren't as sure-footed as we used to be, that is a pretty serious concern. And so there's a lot of landscaping that needs to go in, and the concern was that there's a lot of landscaping that needs to go in. And in reality, if you don't, the only people that will be able to get in there and enjoy it are the physically able people. Anybody with a disability would have trouble getting in, and we want everybody to be available. They're talking about an amphitheater. They're talking about a kids section. They were talking about pesticide use. It was very, very, very good, active group. There are 3 phases. They've decided that naming is the first one. That is the edible forest so far. The concept and the design, which is happening now. And then a management plan for, once we get this great design, how do we take care of it? It is a very long project. You don't plant a tree and have things happen the following year, So it's a very, very long legacy kind of a plan. And so we'll be seeing a lot more of it. They haven't decided on anything. There's lots, with every little piece of landscaping and or amphitheaters, it's interesting how the dollar signs keep flying up. So we'll see more about this as we go on. And then I'll
Gina?
attend planning and zoning.
Sorry, forgive me if you said
Sure.
this. Who put the designs together that you were looking at?
Bernardo Wills Architects.
Okay.
And the lady named Paz, I didn't get her last name, and Bill LaRue.
So we
I think he's the
contracted out
principal.
for that.
Yeah,
Okay,
yeah,
thank
and
you.
we did see that with David Schott maybe a month ago, maybe. And I think they've done a very good job. It's a wonky piece of land, and it's almost a bowl, so how do you landscape that? So anyway, we'll see some good stuff coming. They're doing good work, and the community's very engaged.
Great.
So,
Yeah, go ahead.
go ahead, yeah.
Can I just rewind for 1 second? I wanted to mention you gave the shout out to Ken Fonts, and the high school recipient of the award at the Martin Luther King Breakfast is Ari Carter, who has been the non-voting high school member of the Human Rights Commission.
Thank you.
Yeah.
Very important point, yeah.
And the third winner was the, the law student, I don't know her name, from the law school that got recognized for what she did. I don't know her name. And of course, it was on the paper, but anyway. What was that, the 29th one of the Human Rights Breakfast?
That was 19.
No, she wanted to know what year.
Oh, the 29th
What
one?
anniversary of it.
Yeah, they've been doing it for a while though, haven't they?
26
Yeah. 26,
annual,
yeah.
yeah.
That's really good. So I got to go to Fair and Affordable Housing. They meet at 5:45, but they've changed their time. So if you want to go, they now meet at 5:15. February 7th on Thursdays over in the Paul Mann Building over there. They need members. There are 4 members needed for Fair and Affordable Housing. So any residents that are interested in being on that, because that seems to be an issue that came up. PEP did a presentation, the presentation that we'd had here at council. Just, I think it's, you all are moving to try to get everybody aware of what the needs are in the communities and housing issues. And then the commission is also thinking about doing another housing fair. They did their first one last year. And Ann, did you go to that one?
I didn't know, just heard back the report.
Okay, so the reason they also need members is because there were about 1 or 2, just 2 people that really pulled that whole thing off, and they'd like to do it again, but they just need more membership to begin to do that. So I think if we can help get members to that commission, that would be great. And then there was a safe parking discussion that Linda Pike had done some research on and led, and then they gave a certificate of appreciation to Steve Bonner for all the work he did with Syringa. And they were asking about where did it go? Do you know what I'm talking about? It just says, went to admin and then where? They were wondering, that they said they had written a letter and then they wanted him acknowledged and then they're not sure where it went. So if you could just... Yeah, well, Fair and Affordable Housing, yes, they wrote a letter for an appreciation, and they sent it up to admin, but they don't know what happened to it. So if you could, I don't know that. And then the other commission meeting was Sustainable Environment, which meets at 7:15, and we met over in the Water Department, which actually was a really good space to meet in, because they have a full commission, and we all fit around the table pretty well, and so they did a city sustainability report, and all that work that the sustainability part of our city has done with Nicole and all the rebates. They Kelly did the graph that showed, and I think she'll be coming to us here soon, showing how many more people are doing rebates for toilets and pulling up grass and putting in Y-scape, and she was super excited. And they have a new video that they showed, changes in curbside recycling, which you can find on YouTube, because so many people have been cited trying to figure out how to recycle. Yeah, so they did a really nice job, and
On
Stevie...
the city's website too now.
Yeah, that's what I mean, it's on the city's website, but you
not
pull it up through
YouTube.
YouTube, yeah. So they presented that, and then what's coming up here soon will be the Environmental Stewardship Awards, and then the Earth Day Awards, and they're trying to get ahead of that, and talking about carbon neutral cities, and they were really happy with the resolution that we passed on December 17th with the Citizens Climate Lobby, and hoping to maybe see more of that kind of thing. And we're all going, most of us are able to go down to Boise for the Association of Idaho Cities, and I wish somebody could make it tomorrow for the Water Summit. So from 1 to 5, I don't know how else they're going to be showing that kind of stuff, but there's some stormwater issues, water quality, and water rights policy topics that they're going to be talking about tomorrow in Boise.
Okay. Staff have anything to report?
Nothing from staff.
In that case, I would entertain a motion to adjourn.
Let's go.
All those in favor?
Aye.
Got me out. We stay here longer.
Why did you...